First, I want to ensure that we know that from the health perspective, targeting obesity and ensuring that we are doing what we can to decrease obesity in the state is a priority for Secretary Karen Timberlake and our state. Within our Healthiest Wisconsin 2010 and 2020 goals, which we are currently developing, targeting obesity prevention by increasing physical activity and decreasing consumption of sugary and sweet foods are two mechanisms which are obviously contribute to helping to decrease obesity. Just in terms of some of the rates and regarding the prevalence of obesity, it's important to know that 32% of Wisconsin third graders and 23% of Wisconsin high school students are already overweight and obese. After age 6, obese children have a greater than 50% chance of becoming obese adults. When you also think about policy interventions, and I think it's important to address what we look at within our programs is it is very hard to change behavior and once you have a norm and once you have a setting. So targeting individual behavior is obviously one objective that we do, but when you look at where do kids go, where do kids eat, I think you can see that many kids, and the majority of their meals, some to a third to two-thirds of their meals and where they're eating occurs in schools. So looking at how do we promote healthy eating in a school system and increase physical activity makes sense. It makes sense to help ensure that you're creating cultural and more systemic policy changes to help change behavior. That said, I do think that there are other elements in terms of education policy and other components in terms of mandates on schools that our department is not here to testify on today. Our perspective is from the health perspective and from the public health policy. We believe that increasing physical activity, looking at the fitness grams, is an option that seems to make sense that we've looked at. When we looked at what other states have done, I think it's important to know that California, West Virginia, and have specifically implemented the fitness gram, and about 25% of other states have required physical testing and by BMI assessments. In terms of looking at nutrition standards for competitive foods, 27 other states have adopted similar competitive foods and beverage policies. So there is a trend. I'd also like to think about there is a trend that we've seen at the federal level with the federal stimulus dollars through the ARA, the recovery and stimulus funds that are coming to the state, looking at prevention and wellness strategies and having dollars come to Wisconsin so we can help to ensure that we're working with local schools to encourage healthy eating is something where dollars are coming into the state that we're working on many initiatives right now.